Good day, my name is Dr. John Dombrowski. I'm a board-certified anesthesiologist, board-certified in pain medicine, and board-certified in addiction medicine. I always like to take this opportunity to do these videos, which I find everyone's kind of watching these days. No one likes to read, and I get it. Everyone likes YouTube and very quick information, 2 or 3 minutes. Then you can check it out on ChatGPT or whatever AI engine you want to look at. So, about 4 months ago, I was given information on regenerative protein arrays. That's a crazy term, I got it, but here's what you might remember from your own history that you've heard of. So in the past, maybe 10 years or thereabouts, we've heard about stem cells and plasma-rich proteins, or PRP. Again, what this is all about is the whole idea of regenerating, healing things, doing joint injections, spine injections, things like that. And there is some good data to this. There's also other opportunities that we've used, such as umbilical cord stem cells, Wharton's jelly, things like that. Again, these are more placenta or ethically sourced stem cells. So we've been doing this now for a couple of years, and obviously PRP or stem cells are usually from the fat. They're mesenchymal cells that a physician would then get from your fat, spin it down, or PRP is really from your blood that they would draw and then spin that down and have the buffy coat that they would then inject into the joint that needs to be treated. Unfortunately, there's really no insurance coverage for this, so it could be relatively expensive and with uncertain real benefits. Some people swear by it, some people really didn't help. So the reason I'm kind of asking for this new way of thinking about things are regenerative protein arrays. So this has really taken that same idea but made it markedly better. So what it does, instead of taking cellular material with DNA, this is actually from a donor placenta, and this is in the United States, and the lab is an FDA lab, approved lab in Tampa, Florida. What they do, they break these proteins down, so there's no cellular activity, there's no DNA activity, so there's no risk of any infection or things like that. But what they have found, these regenerative protein arrays, it can be very effective with respect to anti-inflammatory and angiogenesis. That means healing processes. Now, some of these, again, this is relatively new. It's been around for 5 years, but really clinically available for physicians to use the past 1 year. So it's still very, very new. But what we see is anecdotally, which means we're observation, but more information is being derived. Very important with respect to neurologic issues. Again, it could be painful issues, could be helpful, again, back pain, things like that. Not saying it couldn't help, or shoulder or knees. But I'm more excited about the neurologic issue because these are patients who really don't have much choice. So this is for dementia, Parkinson's patients, balance issues, ALS, other MS, multiple sclerosis. So they've actually would do these procedures, again, intrathecally. That means place the stem cells or these regenerative protein arrays into the sac around the spinal fluid. We do that here in the office to keep it safe. And the other portion of that, these regenerative protein arrays would be injected intravenously. This is a one-time treatment, might need to be repeated in 3 months, maybe 6 months, depending on your symptoms. There's been really great evidence that this has been helpful. Again, helpful in that nothing else has really helped these patients. That is the good news. The other good news to this, as me as a physician, is risk versus benefit. So often people who are desperate will just, well, I'll go to Antigua, I'll go outside the United States to get medical care because the FDA does not allow these types of procedures in the United States. This is allowed in the United States, which is a big key factor. The other key factor is that it can be some cost involved, which I do always respect. The company has a way of having a payment plan so you can still get medical care, but obviously you would then work out a financial plan with the vendor. And again, that is really acceptable, and I really like that idea because it seems very fair to patients, and I'm always about what's fair to a patient. So I'd like you to look at our website, look at the company. It's called Genesis Regeneration. and look up the word regenerative protein arrays. If you have any questions about this, don't hesitate to give the office a call. This is relatively new. I've had a few phone calls already about ALS, and I've had a few phone calls about multiple sclerosis. But if you want to call, we're always, want to talk more about that to learn. The other aspect is that do your own homework and, please do your own due diligence. So again, this is for people with long COVID neurologic issues, dementia, Parkinson's, MS, ALS, peripheral neuropathy as well. So do your own due diligence, check this out. But we are very excited to bring this here to the Washington area as well as the country, because we've received already several phone calls on that. Again, best of luck, and please let me know if we can help in any other way. Thanks for watching.